95.9 FM, WATD, the South Shore's Morning News. Rob Hackla and Beth Foster with you until 10 o'clock. Time now to check in with Dr. John Hayes. For a better experience at the doctor's office, try Dr. John Hayes' new, highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com, drjohnhayesjr.com. Dr. Hayes, good morning and welcome.
Thanks, Rob. Good morning, Rob. Good morning, Beth.
How are you, John?
Doing great.
Doctor, I'm so
good.
sorry.
No, John's fine. Please call me John.
No, that felt unnatural for me to say.
That's a good thing.
Oh.
Dr. John.
Yeah,
I know.
My pleasure.
I know. Every time someone says, you don't need to call me doctor, I still want to. Every time.
I know.
It's the same thing.
Don't feel like you have to.
You have that energy.
Dr. Hayes.
Oh,
and, well, speaking of energy, he does have a great energy, and that's what it's continued to attract people over to his practice in Marshfield. We've had a lot of people, of course, that have chimed in that you've made a difference in their lives, and we thought we'd talk more about the difference. Making a difference in their lives is the difference about you and what you do.
Well, yeah. I mean, it's, on my part, we've spoken about this before. I mean, it's a choice to have the type of practice that I have, and I'm very fortunate I'm able to do that. But I do want to thank everybody who's commented. The last 3 weeks in the practice have just been amazing since we've started this series with, people not only calling, but actually coming to the office, just dropping by, seeing what it's all about, which is pretty cool.
Oh.
And most of them are pretty shocked when they walk in and see it's a pretty chill office. And, I've got some pretty chill music playing and, whatever else needs to be done to just try to keep things low key and take care of people. But more than that, I think probably the best place to pick up would be the reason I'm able to provide the quality of care that we can is because I'm completely independent. And like we talked about before in direct primary care, there's nobody looking over my shoulder telling me, Dr. Hayes, you have 15 minutes to see this patient. Dr. Hayes, you can only take one complaint today. If they have more than one complaint, they have to come another visit. There's none of that stuff in our practice at all, none whatsoever.
And that's the kind of thing that, again, if you could envision it, when you're at the doctor's, most of the time there is an invisible person tapping on the doctor's shoulder. You don't see that, but there is always someone there at these other places. You're saying a third party that wants to remind you.
Well, it's just like we've spoken about before. It's a fact of the matter is that's how healthcare has become. Corporate-owned healthcare, treating thousands and thousands of patients per physician versus myself.
Right.
Just having hundreds.
I know. We hear from our listeners. I mean, they go to you and they absolutely say that they've never felt so taken care of.
Yeah.
And I think that's what's so special about it, is because I feel like, doctors in corporate fields, they are overloaded. I'm not saying they're not doing a good job.
Exactly.
I know that my friends who work in corporate medical fields, there's certain restrictions that they have to abide by.
Right.
So it's just really apples and oranges with being able to say that you are kind of operating on a different level.
Yeah, and it does, like we talked about before, it does not mean I'm a better doctor by any means. It's just that I have more time to, be selective and also give patients not only because of the type of practice I have, but because of my personal experience, a wider range of services. And that's, probably the next thing to talk about is because of my background in pain management, previously clinical nutrition, chiropractic, manual therapy, etc. One of the most common problems any primary care physician sees are those related to the musculoskeletal systems. And the two most common would be headaches and back pain. So in our practice, instead of just say, well, you know what, continue ibuprofen and we'll just see what happens, it's more than that. So we can schedule an extra visit if we don't have time to do it on that day, but we can take a look at musculoskeletal issues that could be causing headaches, could be causing back pain. In addition to the primary care, we have the option of addressing those in our practice as well with things like manual therapy, traction, laser therapy, now soft wave therapy, you name it, with lots and lots of different tools. And that's what my patients really appreciate.
I know you've been all over your social media talking about this nerve pain treatment, which really, I mean, as somebody who suffers from sciatica, I was like, what is this, Dr. John? I wanted to talk to you about it.
There's all different types of therapies that are available. Everything from portable neurostimulation to in-office neurostimulation, and over the years, it's been extremely successful in our neuropathy patients.
Oh, cool.
And that's, what we're very, very grateful for. And the other thing, too, is that many, many times, if the patients qualify, they can actually own one of those units and treat themselves at home.
Wow.
And just adding a home treatment to an office regimen saves people a lot of time, a lot of aggravation and money, and plus cuts down their medication oftentimes dramatically.
Yeah.
So true. And people should follow your social media because I love all your tips. They can see you cooking some good
my wife
food.
Patty mainly, but yes.
Yeah, but you lay out all the ingredients because I know that you're a huge proponent of plant-based diets. Yep. And I get a little bit, I'm like, what else can I eat that's plant-based? I love beans. I can't really think beyond that. But Dr. John Hayes.
just try to keep it simple, try to keep it real, and try to teach what we know.
You get creative with the diet.
Absolutely. Yeah.
So cool.
Are you an only vegetarian? Do you have any
No.
You'll have a steak,
we're
right?
plant-based. So plant-based.
What if I'm going to charcoal a nice steak in the summer for you?
Then go for it.
Would you come?
I probably would, yeah. I would. Yeah.
So you're saying, but a little bit.
So, it's not, there's a big difference between what you do 99.9% of the time versus 1% of the time. And this is what gets so out of control. And plant-based does not mean you don't have fish. It doesn't mean you don't have meat.
Don't deny.
But I will tell you that the more plant-based you go, the less you're going to find things like a large steak meal attractive because you feel so much better when you don't eat that load of protein and fat.
It's true. You might fall asleep after that steak.
Well, that's just one of the things, but that's another whole discussion. But
it is another discussion. Yeah, for sure.
Yeah.
I just wanted to let people know that you have so many resources, and one being your great social media, and they can definitely get to know you through your social media.
Yeah, the videos. That's a great point, Beth, because going to a doctor is such a personal thing. So if you get to kind of know your personality and say, hey, wow, this guy does have some fun videos. He seems like, he knows what he's talking about. He's passionate.
And you can feel his demeanor through the videos, too.
Yeah.
I can really feel your carried energy when you're talking about making your dinner.
He's been doing these for a while.
I know.
You've been way ahead of that with the videos, right?
Exactly.
How long have you been doing? Because you've been doing them when you had your other practice.
Well, Rob, back in the day, before medical school, I was doing radio shows here, full radio shows every week, and filming them. And all those clips are up on YouTube.
Oh,
they're still there. So
I gotta watch some of them.
A long track record. WATD has been phenomenal.
Yeah, we appreciate that. We've been kind of
the community.
That's how we've known each other. Yeah.
Yep.
I guess I want to ask too, as far as is your practice mostly for adults? Like, can people bring their children?
So I'm board certified in family medicine, which means we basically treat patients from cradle to grave.
Wow.
Yeah, wow.
That's so impressive, really.
Yeah, that's what I love about family medicine.
Also, I've talked to a lot of people who have been dealing with unfortunate medical situations, and it's always advantageous for them to get a second opinion. And
Correct.
So I think also, especially if you're a parent and your children's going through a medical situation, that is just so stressful. It's devastating. And so I'd say, maybe check out your practice because they can give the second opinion, and then, you seem like you have such great bedside manner.
Well, thanks. And honestly, I don't think it's that hard, but it's personality for sure. I like what I do, and just having the freedom and the latitude and incredible staff to be able to do what I do is impressive as well. The other thing too, which I think is important, is that we're adding more and more tools all the time to the practice. We recently added a very high-level 12-lead EKG system, which has been phenomenal for patients with chest pain or potential cardiac issues. The thing I really like about it is if we need a cardiology consult on the EKG, we can have it within 30 minutes max.
Wow.
So that's
pretty impressive.
It can help us delineate somebody that should go to the emergency room, should go by ambulance, or somebody who could be doing perfectly fine. But just having a wider array of tools in the practice itself, and the staff that can help us administer all that stuff has been really great for patients too.
Oh, that's wonderful.
Dr. John Hayes, drjohnhayesjr.com. Every patient gets concierge care without the concierge price tag.
Yeah, there's a huge difference between direct primary care monthly membership and concierge care, which is usually way, way more money.
I know. And then also when you look at the math of insurance, deductibles, paying for the plan, and then you kind of cross-reference them with the numbers that your practice is able to give, it kind of,
if you just take, this is the thing. So we talked about this last week, Beth, and it's a really good point. I have people that come in and say, what, $2,400 a year? I'm not paying $2,400 a year. And the very next phone call, it's only $2,400 a year? Sign me up.
Right.
Sign up my whole family. What's the cost of my whole family? Comes, they take a look at, okay, so I have a family. I have a deductible. One of my kids had to go to the emergency room. One had to go to urgent care. Then they couldn't get seen. Then they called the primary office. They said they were too busy. We had to go to different urgent care.
Right.
And the list just goes on, and all the expenses associated with that. When they take a look at what they can actually spend by, having a primary care physician that's basically on call for them, ready for them to just bring the family when they need, it's a game changer.
Right. So $2,400, that basically means you can come to your practice for appointments.
$2,400 a month.
Yeah. What does it actually entail?
So here's the thing. So it's age-based membership. Right now, it starts at $97 a month. It goes up to $197 per month max. That is going to change over time for sure. Family plans right now are currently maxed at $327 a month. Those are also going up as well.
Wow. Okay.
But in essence, the issue is that you can pay by the month, you can pay by the year. Many patients use the FSAs or HSAs to pay for it.
Cool.
And many, many more employer plans are now starting to pay for direct care as well.
And then can you do an a la carte month?
Not necessarily.
Okay.
There's a big difference between primary care and acute care. And we take acute care patients as we have room and as we have space, but members always take priority.
Very cool. Thank you.
Dr. John Hayes, he joins us every week at this time. Go read the blog if you want to find out more. Check him out. And again, as Beth said, follow him on social media. You can check out some of those great videos. drjohnhayesjr.com, drjohnhayesjr.com. Dr. John Hayes, thank you.
Thank you, Rob. Thank you, Beth.